Hello, everyone. Welcome back to another episode of the MSNS podcast. I am your host, Ryan Lim. And with me today is actually our co-host, our new one, Alan Tan. He is going to be the new alumni relations / career chair intern. Welcome, Alan.
Thank you.
And with us today is our very, very special guest, Gabriel Legaspi. Welcome.
Hey, what's going on, guys?
Okay, so for anybody who doesn't know, Gabriel was the MSNS president back in 2015 to 2016, correct?
Yep.
Yeah. So before we talk about, what you do now as a nurse, I kind of want to roll it back because there are a lot of viewers that are just, from the current MSNS. They're used to what they see at the meetings through Zoom and all that. But I'm not sure if they really know the history of MSNS and kind of what MSNS was like when you were there. Can you describe kind of the environment that MSNS was when you were the president?
Yeah. I feel like for my 4 years, so I attended USF from 2012 to 2016. And being at the MSNS meetings during my time, it's for the most part, we always had our identity. So MSNS is rooted from our founders of Chad Ortega, who's possibly still active on campus. He developed the club from what I understand is an African proverb, actually, is each one teach one. So back during slavery times, when a slave would learn to read, they would say each one teach one, in terms of if one person learned to read, they were responsible for teaching everyone else how to read. Or if it was a certain skill that someone learned, they would be responsible to teach everyone that skill just because it's passing it on. And that's what I experienced my whole time when I was in MSNS myself. I always experienced all the e-board, all the upper division, juniors and seniors trying to pass on that knowledge to me. So during my time, that's exactly how it was. Juniors and seniors were always trying to help the underclassmen kind of pass through like the gauntlet that is nursing school. And there are challenges along the way because even though you get more knowledge as you get up in being a junior and a senior, the time to be able to devote all that always becomes less and less as well. So during my time, MSNS was still not necessarily trying to find its identity, but where we could really establish our base roots and where we can really flourish in terms of balancing, hey, we're this club, we have all this motivation, we have all these very intelligent people, but how can we use our time wisely so everyone can still graduate, but we can still participate in campus as a club? So that was kind of the fine line that before I was president, during when I was president, I'm assuming after I was president, that's kind of where we were at.
Yeah, I like that. Even with all the time constraints that you were talking about and all the struggles that come with nursing, you were still able to lay that foundation for MSNS, each one teach one, because as formal as nursing school is, as much information we learn from the classroom and clinical setting, there are things that we don't learn in nursing that we probably should, like stuff about post-grad applications, jobs during nursing school that we could have. It's not taught at USF really. So I think It's awesome that you were able to lay that foundation, say, hey, MSNS can be a tool where we can teach you these things. And hopefully once you've learned them and mastered them, you can pass it on to the next generation.
Yeah, I feel the same too, because I feel like without MSNS, even for me, like I joined recently, like knowing all these different people really builds like a little web of connections that you can always go back to and really like have those communications for I'd say for the rest of your life, because nursing school itself, it's really hard, right? At least in my own experience, I did not have I wasn't part or I wasn't like necessarily too close connected with MSNS, but I had a ton of friends in it that made me want to join. But it's just like those time constraints, just made me unable to. I was still able to talk to them outside of it and get great information and like what classes I should pick next semester, like, oh, how did this clinical go here and everything like that. And I feel like MSNS really builds like a really good community by doing that.
There's definitely there's definitely cruelty likes company. Or
Oh
suffering likes company.
yeah.
I forget
Oh
the
yeah.
Yeah, dude.
Oh
exact words,
yeah.
but when you exactly when you can get the information from the upperclassmen, hey, this is how
Yeah.
you should manage your workload. This is the classes that you should take during this semester. Some people, I remember in my freshman year, took anatomy and micro versus anatomy and physio. Actually, no, not even just anatomy by itself, but they paired it up with another one of the prereq classes. So having that, again, that I completely agree with you, Alan, that having that storage vault of information ready to go from MSNS can be really helpful.
Yep.
And what were the meetings like back for you then, like for MSNS? Because right now for us, we kind of have like through Zoom calls, we kind of get like a good number. We get like 20, 30, sometimes even 40 people come in, and it's super diverse from all cohorts, both males and females. I was wondering if it's something similar or if it was like completely different back then. What was it like?
Yeah. I'd say pretty darn different from back in my day.
How big were the
So,
groups like? Like how many people were in like every meeting of like give me like a good number of like how many of the members would come. Like it doesn't have to be members necessarily. It's just like people that come in and are interested in joining the the society even if they're not part of nursing too. I just want like some insight on that.
Right. So there's always the first meeting rush where there's like a good 40, 50 people. And then as you progress through the year, that gets less and less, of course, as people lose interest. So I'd say what I could fondly remember is during when I was president, because I was the one that had to make up the meetings, I had a pretty good core of maybe about 15 to 20 people that would come. That would be core. Actually, maybe even a little less than that. We weren't co-ed then either. Not necessarily like, girls weren't allowed to be at our meetings, but it was more like there was an understanding, yeah, it's MSNS and you have NSA. There wasn't really that co-mingling. Not that we didn't encourage it, it just wasn't there. Actually, yeah, a lot of the time it was just my girlfriend at the meetings, and she was I don't know, she might have been one of the first females, if not the first female, to get a stole from us. So
Nice.
how meetings were, sorry, the second part of the question is how meetings were
Mm-hmm.
like. It varied because we were trying to, or at least in my presidency, it was trying to balance, hey, I know you guys are taking time out of your day no matter what a semester you're in. So how can I make this the most fruitful for the members coming in? And of course, we would have days where it would be topics that were like exclusively like kind of sophomore one. Hey, how do you survive your first clinical, med calc, workshops, all that jazz, even though that does span the rest of semesters, but also kind of everything that encompasses nursing school itself. How to be more present at clinicals. How can you get that letter of rec from that teacher? How do you present yourself as that ideal student? So later on, it can help you, or strategies to tackle in these courses. Not really content-based stuff as much as, because it's just too much to cover, but more so conceptual. And then we would also have like alumni nights too, where we would invite alumni. They would give us like what you guys do too, give us their spiel just to see how it's like in the real world. So I don't think it's too far off of what happens now at MSNS, but
Yeah.
it's just a little different flavor.
Yeah, I feel like now, not saying it's either a good or bad thing, something that I've kind of definitely noticed, judging by what you've said, what Shane said, what other past people have said, is kind of this shift from uh, just professional development to kind of adding in or emphasizing personal development. Like that's why during the end of our MSNS meetings now we have like these heart-to-heart talks, these story times where we kind of share our personal things about maybe struggles that we've had in our lives and how they've kind of related to nursing, how they've kind of built us up, made us stronger. And I think in a way, I think it's like, yes, I would like more professional development. And I think that's partially, both Alan and I's job to do that. But I think it's nice that now we're kind of incorporating more personal stuff that, hey, you know, it's not just about like what's on your resume, what qualifications you have. It's also the person you really are. And I think that's something that all of us want to find in college and throughout college, but it's just something, you know, it's a big struggle. So I'm grateful that MSNS is helping us out with that.
Well, I'm glad that you guys implemented that actually, because that's exactly kind of, now that I think of it, is definitely what we were missing. I mean, yeah, nursing school. Now thinking about it from our previous talks to Ryan, definitely yes, the alumni relationship is important, but more so because now that I think about it, yeah, in my cohort, I'm very close to a subgroup of people, and you know, I built those relationships in nursing school, and now I can call on them for professional relationships as well because they're being NPs, they're doing whatever they got to do, and I definitely think that was something they were probably missing back then in MSNS that I'm glad to see now because I feel like nursing school, it just brings out, of course, the most professional in someone, but not necessarily the most real out of someone, just because you have to keep up that image. Even though you're drowning, you don't want anyone else to know that you're drowning, things like that. So no, that's a great idea, or a great implementation.
Yeah, because I feel like in nursing school, especially being in such a professional environment, like you were talking about how people feel like they're always drowning, right? It's always, I think, for me at least, it's really awesome that we have this ability to really open up and have those heart to hearts, because I think nurses really need that, you know? Like we're always asking, oh, how are you doing? Or like, are you doing okay? But like sometimes we need that same, that same response back, just to have
Yeah.
some affirmation for ourselves. And I think like going further with MSNS, like having this in place will really help build our nurses, not just professionally, but like emotionally,
No, yeah, that's great implementation. I didn't even know about that.
Yeah. Yeah.
You guys
Yeah,
kind
it's
of
just super
blindsided me
awesome.
there
No,
on
it's
that one. I
awesome.
was like, oh shit, that's
Yeah.
pretty dope. Okay.
Yeah. Yeah. I think it's important that we have that kind of sense of community and support because, you know, judging from what you've like both Alan and Gabe, you guys just said, it kind of feels like as a nursing student, as a nurse, you kind of have to mature and grow up real quick, like in a professional and personal sense. Like even if no, we can always, you know, MSNS, we're always gonna be clowns, we're always gonna joke around and all that. But at the end of the day, we gotta grow up real fast to do what we do. And sometimes when you're still like in your 20s, even like your late teens, it's a super big conflict trying to kind of stay present, live in the moments, and still be young while also knowing that you have to be the one that's actually taking care of all these people.
Yeah.
Exactly.
I completely agree. Like graduating nursing school at what, 21, 22, 21, you know, you're applying for jobs, you're doing NCLEX, you're doing all these very mature things. You're paying bills once you get a job.
Gosh,
And then I mean,
Yeah,
now you were paying loans. Now looking back, I'm like, well, I mean, there's people still like my age now. I'm 26, and it's like they're still trying to get their lives together that I knew from college. So I agree with that as well.
Do you think like MSNS really helped you push you towards that direction where you were able to mature to the point where you were able to be very autonomous in your thought? Like you're talking about how you've got everything together. Do you think like being in part of MSNS was that really beneficial?
I'd say when I was a very active member, so on e-board, when you take on these responsibilities. So of course, being an MSNS alone, yes, you have that knowledge, or at least people letting you know, hey, this is how it is. This is how we can help. However, I also think it's kind of taking in part of myself, because you can only help yourself, literally. Once I became e-board, once I thought about, okay, how do I impart the knowledge I obtained onto the next generation? And that's kind of where MSNS made its biggest impact on me, because again, coming from each one teach one, it's not being selfish, always helping others, to kind of like coming from behind you, and then always be thankful for people that are ahead of you and giving back to you. So, and I still carry that on with my nursing career. So really being an active member in MSNS did really impart that on me.
It's really awesome. Yeah.
Yeah, and I don't know. I feel like I'm very happy and satisfied that we are seeing that retention rate and growing number of active members. Because before, sometimes a lot of us were concerned because there weren't a lot of people at the meetings or at the events. We were concerned that, hey, oh shoot, are people just gonna do this just for the stole? Of course, the stole is nice because provides an intense incentive and an opportunity. But we're scared that, hey, the e-board is putting out so many opportunities where we are so passionate about nursing and like building the community. Is it all going to waste? But I think now that we're kind of through Zoom, we're like enabling more access to our opportunities and events. I feel like we can really see like, hey, it's not that they're just going for the stole or the writing on the resume. They're really there to be involved, learn, and help others, which I really think is awesome. And when I was sorry, I lost my train of thought. Give me a second.
All good. While you're thinking about it, I do appreciate how you guys now definitely have that feeling of camaraderie. Not that we didn't have it before, but more so the social camaraderie. Because back in my day, yes, we all hung out and whatnot, but it was more so like, okay, we're trying to get business done, and then and back in my presidency, it wasn't really a lot of social stuff because all the e-board was like seniors and juniors, and I don't know how you guys handle schoolwork, but everyone was drowning. So it was kind of like
I still am.
We got this.
Yeah.
We got this. Let's run with it. Let's go. And then let's go back to, do what we do. But you guys have that more holistic approach, which seems like, which I can really appreciate this time around.
And how did that change, like when you graduated from nursing school? Like because you always build this strong support system in MSNS with all your friends that you made at school. But then once you graduate, a lot of them who are not from the Bay Area or whatever, they're going out of state, they're going out of different areas to pursue different jobs. How do you kind of maintain that social and emotional support while you're going through that rough time of new grad?
It's a good question. Well, mainly I'm one of those people where it's like, personally, I'm one of those people where it's like, I don't have to be in contact with you for like months and weeks on end, but as soon as you contact me, it's like there was never that time gap. And I hold that to heart with all my cohort mates. So there was a time, completely right out of nursing school. Yes, we were texting each other, hey, there's a new grad here, there's a new grad there. How do I present myself? How do I do this? All nerves. Hey, let's go drink, things like that. But as everyone started getting their new grads, because no one really settled quickly. So by that, I mean, hey, I'm going to stay in one area and wait for a job. There's a lot of people dispersed all throughout California. We kind of got busy in our own new grad life because it's time consuming in of itself. But overall, even to this day, when someone's having trouble, we'll start texting each other. We have this one group, we'll start texting each other like, hey, how's it going? I'm trying to look for a job. I don't like it here. Do you guys have anything? It's like there's no time gap, essentially.
Awesome.
But I mean, of course, over time you do grow apart after like 5 years now out of being nursing school, but the love's still there.
Yeah, and I like how you talked about being able to really even not seeing them for like like your new grad, you're not seeing them for a few years, but like every so often you get that that text and like, hey, what's going on, like how you doing? I really appreciate how you're able to really connect with them in that way where you're able to bring back all those memories from when you were back in college and really talk to each other like nothing happened in between. And I think that's really, really crucial. And I think that's also one of the goals of like in MSNS where we're able to, still keep these connections even after we're done and we're graduated and we're on with our own lives, because it's always nice to have that support system.
Right.
Yeah. And I feel like that's not just like beyond MSNS. I feel like that's a huge step in anybody's friendship where like you go from seeing each other every single day, talking every single day, and then you're apart. But then having that ability to always just jump back right into the friendship, I think that's so crucial. And I think that's what kind of makes a friendship last in the long run. Because I always kind of have this thing where when I reflect back on my friendships, sometimes I think like, especially in high school, I always think like, oh, was I really friends with them, or was I just, talking to them because they were there? Were they kind of friends by proximity?
Yeah, exactly.
Yeah. And I think after college, or like once I transitioned from high school to college, it really shows that who was your friends by proximity versus who were your actually like real friends that are going to always be with you no matter how much you talk to them or how little you talk to them.
Right.
Yeah. And was that let's see, was that difficult for you like when you started new grad? Like was it difficult to make, I guess, new friends where you started at, or like especially with your coworkers and all that, or was it kind of just smooth right out of the gate?
Yeah, like how was that experience like?
That's it fairly smooth. When you guys get into your new grads, and I'm talking to everyone, you'll notice there's easily a huge discrepancy in terms of age differences. Like going into 21 as nursing, everyone's gonna be like, wow, like what do you mean you're still in high school? You look like you're still in high school.
That's so true though. You're literally a baby in their eyes,
You really are. Like I was the youngest one in my cohort. The next person up would be the person my age now. So there is that maturity difference. So, but regardless, I mean, everyone's going through their struggles together, and it always helps after like a new grad class. So when you guys have or new grad programs have those didactic classes, where you go practice skills or have lectures and whatnot. It always helps when you guys can go out and, go to happy hour after a class or something. And I mean, even now I still maintain some of my new grad relationships because I mean, I've been moving around hospitals a lot, but I'd say it's fairly easy just because everyone there is new, they're nervous, they don't know what to expect.
Yeah.
For me, it was more so getting over my age where I'm like, dude, like some people have like kids, like how do I connect with these people?
yeah, for sure.
That was my biggest struggle, was like, oh crap, like I'm young, like what do I do?
Yeah. Did you feel like you had to grow up even more because you're around so many like seasoned nurses? Did you have like this feeling where it's like, oh, I gotta be like on their level and like eliminate, all those feelings of being like a kid, like you want to live your 20s, you want to go, do stupid, you want to do stupid shit,
That's what's up. Yeah.
Yeah, like for me at least, I've been always thinking about this, like, oh, like even though I'm a nurse, like as much as I want to stay professional, like I still want to have the ability to go out and like do what regular like 20-year-olds do and not really like, settle down and just start working my ass off and like really like experience life to the fullest, I just want to hear like how'd you deal with that like type like that turmoil, like balancing professional life and like being in your 20s?
Yeah, it's definitely, well, it's a balance. Full transparency, I kind of went more so the work route because I'm trying to pay off loans and trying to get back into school actually at this point.
Yeah.
But looking back, because my whole 20s, I was like, wow, like, I feel like I'm 35. I feel like I'm 40. At this moment, I feel like I'm like 50. It's my biggest advice to you guys is, I mean, if you don't have any loans, world's your oyster. If you have loans, if you can try and minimize, live at home, if you can live home rent free, all that jazz, do it. But in terms of the fun part, again, my biggest advice to you guys, I don't know what that entails, but just advice is keep your social media in check. Like keep it in check. Have, have a Finstagram ready to go that you don't add coworkers on. Have a Finsbook. I don't even know. I don't use Facebook. I don't know if you make a fake Facebook. I don't think that's a thing. But because coworkers start adding you on Instagram, everything, and then that one day that you might call off sick. Ooh, and then you start posting posting some stupid stuff on Instagram, then that's when they catch you. But it depends on your relationship with your coworkers as well. So really, because you guys are going to be making, I mean, at least in the Bay Area, more money than any 21-year-old knows really what to do with. Like fuck, I saw all my coworkers. I'm like, how'd you get like 3 Yeezys this month?
Oh yeah, for sure, dude.
That was way back in, what is it, like was it 2017 or something? Like
Yeah.
whatever was popular back then. I was like,
Yeah,
how are
the
you guys
Yeezys
just
were popping back then. Yeah, they were expensive too.
no, they were buying like turtle doves, like
Oh
pairs of
my,
turtle doves. I'm like,
that's
how are you
crazy.
spending like a G on every single like week?
Yeah,
But the bet again, balance is there. As long as when you're at work, you're 110%. You're cool with your coworkers, your managers. You're always very helpful. You could live your 20s because nursing schedules also are the best because some let you self schedule where you can get, like in my job, for example, I'll work six 12-hour shifts, be off for a week, and then I could actually be off for another week and then work another six because I work all my shifts in like one go essentially.
Wow.
yeah.
So you have a lot of room. You have a lot of room.
Yeah, like I think like you speaking on like how to be like still be in your 20s and speaking about how like professionalism and give us really like good insight on how to like we should control our social media, you know? Like I think it's like really good for us nursing students to hear that. It's like, yes, you can still enjoy life while being a professional nurse, you know? And like from what you're saying, it's just like it's like a sigh of relief for like a lot of us too. It's just like, oh, because I feel like some of us are thinking like, oh, as soon as I'm a nurse, I gotta work. But they don't understand that like there's just so much more things that are happening outside of nursing that I do that I want other people to experience also, you know? Like go ahead and buy those Yeezys, bro. Like make yourself happy. Just don't post that. Don't post that shit on Instagram, you know, and like rubbing other people's faces.
Yeah, there's a problem. I was definitely in your guys' shoes. Like I remember my first. Sorry, those are my dogs. My first clinical instructor came in with like a Gucci backpack. Like
damn,
it was like one of the few male instructors too had like at least a $2,000-3,000 backpack. I don't know how much those cost.
Yeah.
But he was like, no, you guys chill out. This is the hardest part. After it's all easy. I mean, I get used to your new grad. After that, there is a life after nursing school. There is a life after nursing school. Just one step at a time.
Yeah.
But I feel like something that I want, and I'm sure a lot of people at MSNS want to emphasize also, is that you can also have a life in nursing school. You know, I feel like, yes, nursing school is super damn hard. And like, you know, we work our asses off, like 100%. We work,
preach.
Yeah, but bro, we gotta live a little. Like, it's like the balance you said outside of like post grad. We need that balance here, or else we're gonna burn out real quick. And I don't know if I mentioned it on like to you or to like other people on the podcast before, but like I remember specifically my freshman year, like me dorming, I was grinding out every single day. I was like studying probably 24/7 for microbiome and all that. Yeah. But I think me now, and even me as a sophomore looking back, I'm like, yes, I did well in microbiome. Yes, I got that A. But honestly, if I had a chance to do it again, I might have sacrificed a little bit to have a little bit more fun, like in the dorms and all that. But that's what I want to pass on to the freshmen. Like, work hard, do your shit, but have a little fun, you know?
Yeah, exactly. Just adding on to what you were saying about like, oh, I could have sacrificed a little for that. I feel like I did that and I had a lot easier time like transitioning into like my med surg rotations, actually starting nursing theory classes. I think like having that ability to really balance it in between and still be able to like really get the theory courses and acquire grades that are really like that you're acceptable with. I think that's really important. Right. Because then nursing school is so tough to the point where sometimes I feel like I'm burning out. Like, I think from my personal experience, I think last semester when we were taking HESI, when we were studying for HESI, like that was probably like the studying part wasn't stressful, but it was just the test taking part because I took the right precautions beforehand where I didn't have to stress myself over that testing. Right. And like find different ways to like relieve stress or like put my mind off of nursing. You know, and that enabled me to do pretty well in the HESI, right? And I was happy with my grade and I was happy of the outcomes and like all the things that led up to that.
No, I agree. I kind of wish I had your guys' talk probably back in my day.
I probably should have had this talk. I didn't have that.
I probably should have had this talk way when I was in nursing school. I hit nursing school hard. Like as hard as I don't know. I pretty much if I could allude to someone who would probably give really good advice on how to maximize, the college experience and nursing school, it would be one like my VP. His name was Jason Jamer. I actually text him after this and see if he'll be willing to talk to you guys.
That'd be awesome.
Nice.
You can definitely have fun in nursing school, and you can definitely still be successful in a nurse. He's going to be a nurse practitioner. He's in school right now at I think UPenn or Penn State.
Wow, nice.
One of the two. Yes, have fun. Have that fine line of being able to de-stress, because then some people, they take it a little too far, and being kids, they'll be like, all right, I'm de-stressing, and they keep de-stressing.
Gotta be careful. Gotta be careful.
Remember, like, bring yourself back. And I definitely did have fun in college. I wish I had a little bit more fun in college. But also at the end of the day too, the amount of work that you guys put in is what you guys will also see outside of nursing school as well.
Yes. Yeah. I feel like I actively try to remind myself that a lot, because sometimes when you're staring at your screen at all the PowerPoints and all that, sometimes you're like, what am I doing? Like, am I going to remember this in the long run?
So tired of it, man.
Yeah. But I feel like knowing what other people have said, knowing what you've said, it's kind of like, it's not that you're going to have to, well, some of it you're going to have to memorize, but a lot of it is just in nursing school, is just creating that foundation, right? For critical thinking, being familiar with a lot of medical terms and everything, so that you can have that foundation going into your new grad program. Mm-hmm. But that's so hard to remember, especially during finals. I'm just like staring at the screen. I'm like, man, this is a lot of stuff.
It's only a short amount of time. Yeah, I still looked at. I recently looked at. I was like, oh shit, I still have Dr. Kwong's old PowerPoints from way back in the day. I'm like, I don't remember any of this shit.
Yeah.
I don't know how I did it. I don't know how I did it in that class. I was like, crap, I don't remember anything. So short amount of stress. Yeah. Short amount of stress.
Because I feel like, especially in nursing school, it's a lot, like a good balance between theory courses and really getting experience in your clinicals is really important. Like, I feel like at least for me, I always tell my clinical instructors, like, every time they're asking, like, oh, how are you doing right here? Like, how do you remember your theory courses? I always tell them, hey, like, I actually learn more in clinical than I do sitting down in lecture. Right? I sit in lectures, so I get exposure to these things, but to really understand, like, what I'm doing, or like what I'm doing in like the nursing unit, I get all of that from the experience, right? You learn from the other nurses, you learn from the doctors, you learn from your own experience. And I feel like a lot of times nursing students really don't feel the same. They work so hard on their theory courses to get that A, but then when they're back in their in their clinical unit, they're just like at a loss, because what they've learned, it's just not applying. It's just hard to use.
Yeah. It's I teach right now the MSN students for they're the equivalent of maybe a sophomore like a junior 2+, if that. And that's exactly their sentiment. It's bridging that gap between theory and clinical, where it's just finding that click. So I agree with you on there too.
Yeah, I feel like, I don't know, there's got to be more repetition. Like, I know with all the stuff that we need to cover in all of our courses, it's hard, but I know that certain LVN programs or other programs, they have a daily check off list or a weekly check off list where, hey, you need to do a certain amount of intradermal injections a day or IM injections. And that's how they keep, their skills up. But for us nursing students, we get checked off like one time, sophomore one. And like, we hope that, we get practice in clinical, but there's no guarantee that you'll ever get that practice.
It's just super crazy. Because then for myself, I've been working at a clinic outside of USF. This is a private clinic, a private doctor's office. And I'm a fluid injection nurse there. Right. And that was the first time I've been doing IM injections. I haven't done an IM injection with USF so far in my nursing career.
Yeah.
How, like, that's just so crazy to me. Like, if I did not have this opportunity, and then this nurse, like, in my med surg asked me to administer an IM medication, I'm gonna be like, my pants are gonna be off. I'm just gonna be flying everywhere. I'll be shaking. I'll be scaring my patient of how much I'm shaking. And it's just like, having that experience really helps. It calms your nerves, and like, you understand what you're doing whenever you're in clinical. And I wish like nursing school, at least at USF, enabled our students to really practice a lot more in the clinical setting. And it's really unfortunate how during this COVID-19 pandemic, we're having less clinical days due to unable being in person. And I think we're missing out on like going to sim labs and going to practice your skills. And I think that is very crucial, like a very crucial part of nursing school that we're missing. It's really unfortunate that it is happening like that.
Yeah. So I guess dissect your point in two parts. Yes, clinical, completely important, practice skills. It's just such a, because I'm thinking back in my time too, when I was a student, opportunities in clinical are also by chance as well. Because, because I'm just speaking as an instructor myself, because I'm like, oh, I wish every single day we can put in a new IV.
Yeah.
Unless they just put it in me or whatever. And, those opportunities seldom come by. When they can, I'm like, okay, let's go. Even though the student's like shaking, I'm like, okay, just try it once. Trust me, it's not as bad as it is. I know USF does try to give you guys as much opportunity, or at least is trying to. I don't know exactly in this pandemic. I know they are trying hard to stay in line with the county and whatnot. But also, and I realized as a student, I never did put in an IM injection.
Oh, wow.
Oh shit.
I think the only skill I practiced is probably like a Foley and like a few IVs, but never IM. It was pick and choose. The main thing though that I would want to impart on you guys is getting the critical thinking of everything, because skills, that's just going to come by regardless, no matter what you do. Me personally, I still have only put in like maybe like 3 or 4 NG tubes. Those are also hard to come by. You'll see that there are skills that you just get really good at real quick, like blood draws, IVs, whatnot. But the critical thinking that you guys develop during school in terms of, hey, I'm getting this septic patient, I'm getting this heart attack, what is the algorithm I got to follow to get this person better, versus, hey, I got to put in an IV in this person. That's going to come. But knowing everything else around it and being able to, and I was pretty sad that we couldn't do sim this semester, because I was a sim tech myself when I was in school. But getting that knowledge, getting that repetition, as you said, Alan, like, hey, I'm seeing sepsis, I'm seeing code blues I was a pediatric sim tech, all those scenarios over and over again. I converted that to real world experience. Like, hey, this is what I know to do with my patient now. So yeah, I don't even know. I kind of went on a rant. Sorry, guys.
No, it's okay. Yeah.
No, it's totally perfect. Yeah. Like, I really do miss out on doing sim, because I had such a blast doing it, whether I did it right or wrong, because I love learning from my mistakes.
It was so fun.
Like it's just something that I like in nursing, like I had this like thought going in, I need to like have repetition, I need to practice, and like having sim lab in place was actually something that I really, really wanted and I looked forward to, even though I had to like wake up at 6 every morning to get to sim lab at 7 and like stay there till 5. But I still had a good experience because time went by so fast and I was learning so much more than rather sitting in lecture, and it's just great. And I'm so sad that we have to miss out on that this semester.
Yeah, it was cool. I always picked out like random stuff out of the room that wasn't even like tied to the scenario, like meds that weren't even like supposed to be there and stuff. So I always messed up at sim, but it was fun.
And when did you get that repetition and that opportunity? Was that during your new grad, like when you were in med surg and med tele?
Well, mainly my first exposure was as a sim tech. So if you guys could still apply to be sim techs in your senior semesters, then I would highly recommend it. Otherwise, it would have been I'd say my med tele rotation, just kind of you see those same diagnoses over and over again. Med tele, you're always going to have some type of chest pain. You might always have some type of stroke, depending if you're a stroke unit or not. You're always going to have congestive heart failure. So you become really good at those diagnoses over time. So really, I'd say since in your guys' preceptorship, you go to what, clinical twice a week, 3 times maybe, just to get hours in. When you're a new grad, you're constant. You're working like 4 or 5 days a week, so those skills build up really fast.
That's good to hear.
Yeah, and I'm excited. And I feel like you being in ICU right now, it sounds like you starting off in med surg really helped you, because I feel like I think I mentioned you before, but like when I think of ER, I think of like the loud kind of teamwork, chaos, and all the stuff that comes about like running that. But when it comes to med surg, it kind of sounds like it's a silent chaos where like you got to do a lot of shit, and there's a lot of organizational planning that has to go around. No one's really like outwardly like panicking, but you can tell that you need to like get on top of your shit in order to like survive as a med surg nurse.
Oh yeah. It's not even quiet either. It's still loud.
It's still loud.
Yeah.
ICU is a silent chaos. Everything else is still loud.
Yeah, but you feel like med surg prepared you well for ICU?
Oh yeah. I definitely have a profound appreciation for med surg and med tele nurses, and transitioning from new grad to med surg, big learning curve, but it's you can get over it. Transitioning from med surg to ICU, that was even easier, because then all your time management skills are there. At least you have a good knowledge base of some diagnoses. Now it's just kind of enhancing your knowledge further, just knowing a few more drugs that you couldn't give in med surg. So, I loved my med surg days to a point, of course.
To a point. What were certain cons that you kind of experienced during your med surg days?
Really, I can't really say there were any. The only con is that it wasn't ICU, because I always wanted to be ICU. But otherwise, everything that I learned in med surg, a lot of the stuff I'm still doing now. So can't really say there's a con. It's just you learn to think with your head off, or you just learn to pretty much do tasks pretty quickly. ICU, that's where more of the thinking happens.
And you've mentioned, you've always wanted to be in ICU, and I feel like everybody as a nursing student, whether they have family members, friends that are in ICU, or they get their depiction from like online or from worst case scenarios, TV shows, what ICU is like. Do you feel like it was exactly what you expected, or what was it like once you transitioned from med surg to ICU?
It's pretty much what I expected. I mean, when you see like the Grey Anatomy show where they put out like a literal straw from your mouth and like, hey, let's take out this breathing tube, and the person's like wide awake, it just doesn't happen like that. Yeah. And then he's like talking the next second, it just doesn't happen like that. But I'd say my expectations were met. I did my preceptorship in an ICU, so I kind of already knew what to expect, at least just environment. I didn't know the meds as much. I didn't know like a lot of charting and whatnot. But transitioning from where I was like Kaiser Oakland's med tele unit to San Francisco General's trauma and neurosurgery ICU. I mean, when you hear trauma, you just think blood and guts like all the time, and it pretty much is blood and guts all the time. Yeah. Or like neurosurgery, you think head traumas and stuff. So all the equipment, all the things that you see online, like when you look up ICU, you see those thousands of pumps. Most of the time, it's not like that, but then you do get those days, and we have quite a number of patients right now that have all those things.
Oh. Yeah. I just think that it's important that we hear directly from you guys, like through just through these videos and all that, because I think as much as I want to be informed about the ICU, I don't think there's no amount of lectures or me reading words on a screen can really capture kind of the physical and emotional toll, the things you learn, everything that goes around in the ICU just from that. I kind of have to hear it from you directly,
Yeah. No, I agree. And then theory, I didn't do too hot in the critical care course at USF, because all the stuff that you learn that's about the ICU, you have to see it. Like an arterial line, for example, it's such an easy concept when you see it in clinical, but when I read about it, I had to read it like 15 times over, because you just don't I didn't conceptualize it.
Mm-hmm.
Yeah, what are some of the things that you want to let the like aspiring ICU nurses know, like from your experiences?
Just in general.
Yeah, just anything. Just give them some tips and tricks, you know, like what they should expect, or like anything like that.
For my aspiring ICU nurses out there, if you guys can get into ICU right away, do it. Because if that's the unit that you know you want, that was the unit that I always knew I want. I just had a different route, but if you could start in right away, I do it. The other thing too would be, while you guys are in school, really pay attention again, the critical thinking skills, conceptualizing and knowing the algorithms for at least the big diagnoses, stroke, heart attack, sepsis, and having your ACLS, because I think USF still does that, where you can grab all your certifications. Just having those on lock and practicing those scenarios in your head, you'll kill any job interview.
Awesome.
That's good to hear, because I feel like that's a super big thing that, you know, it's part of our kind of e-board chair thing, and probably a big concern for all juniors, seniors, probably now freshmen, sophomore too, where we're all thinking about, oh shoot, like when it comes down to like applying for all these jobs and going through all these interviews, like what do I need to know? How do I prep for any of this? Because I feel like, you know, it's not something that's really spoken about in nursing school, and that's why we have MSNS, where we can have that each one teach one thing.
Mm-hmm.
Yeah. I don't know. What was it like for you? I know you kind of talked about it to me like beforehand of this podcast, but can you kind of explain a little bit about like your kind of what you did in Capstone and how you were able to kind of use that and put your resume down so that it could be useful in the future? Can you talk a little bit about that?
Oh, sure. Yeah. So I did my capstone at Kaiser Oakland's ICU, so kind of where I started new grad, essentially, Kaiser East Bay. And being in clinical, be present, you know, be interactive, try and learn as many new things. When you're sitting down and not do anything, ask other nurses if they need help, even if it's turning a patient, cleaning them. ICU or nurses, nursing students, nurses, they remember who helps them, right? And also remember that food is the best way to go to a nurse's heart or their stomach. Their heart is through their stomach. So I always was an avid bringer of, so I was night shift, so I always brought some pastries on along the way. I know it's a little bit of like, hey, it seems like a little much. It is, but I got a job out of it, so I can't really say much to that. Yeah. So that's just one, being a part in clinical. Two is developing that relationship with your clinical instructor. You know, letting him know, hey, this is how things are going. This is how I want it to. This is how I want to progress. You guys will have a capstone project, or at least I did. I don't know if they made away with it. Don't just be limited to talking to your clinical instructor. I'll be also in communication with your preceptor, as well as the nurse educator and manager. So I was avid in going up to them, be like, hey, what projects can I help with you guys around the unit? And nursing student to automatic ICU, there's little projects that I can help out with, but is there something that I can do in ancillary, like color coding something, making things more visual? Nurses like visual things on the unit, or at least nurse educators do. That's what I helped with. And then at the end of it all, not even towards the end, I started thinking about, hey, I got to drop a resume at some point. So I went to CASA, I talked to Chad, I talked to all the alumni that I knew through MSNS, as well as I was a part of a fraternity as well on campus, XYZ. I talked to a lot of them. We had a lot of nursing alumni. And I put together their inputs, their resumes, and then I took that, went to CASA, had it reviewed, really edited it down. Really, nursing resumes, especially for nursing students, should only be one page. Get every single little detail down, and then just dropped it with like a nice USF folder with a cover letter and to the nursing educator's office. And then I know it's going past your question, but apart from that, I didn't have to formally apply for my job because Kaiser likes to pull in from internal candidates. So they had my resume ready to go. They had my project that they knew I participated with. They had the feedback from the nurses that were on the floor with me. And that kind of just all compiled together into, hey, we're interviewing for a new grad program. So
Wow.
it's kind of like all hard work going into fruition.
Yeah, that just kind of goes to show you that you definitely need to make the most out of your capstone. You know, you might be there just to kind of shadow your preceptor or just do things here and there and learn, but it's a lot more than that. It's about kind of just job prep, making that impression while also just learning as much as you can. And yeah, I think that's really, really good advice for all the people that are going into capstone right now, kind of going in blind, I think, because of everything going on with COVID. Yeah.
Well, the hospitals that are around the Bay Area, most of them do have new grad programs. I don't know at this point, obviously, but historically, yeah, all of them: Dignity, Stanford, UCSF, Kaiser, Sutter, all that.
And how has that been for you? Like, especially when COVID hit like super, super hard in the Bay Area. How was that for you personally, being someone in the ICU?
A lot of overtime.
Yeah.
A lot of overtime.
Yeah.
It's being in a trauma ICU. It was interesting because, I mean, the traumas never stop. There's always someone getting shot. There's always someone getting stabbed. What have you? Always someone car crashes. But there was actually like an inflection point about 2 about 2 months ago where honestly, like, all the traumas stopped. And I think everyone finally kind of just like, I'm just gonna not do anything because they're done shooting at each other because they're so bored. They're just at home all the time. But in the beginning of COVID, everything was crazy. We were operating 200-300% capacity at SF General. So we only have so many nurses. So it was like overtime, no breaks, things like that. So just hearing like what people say on the news about this pandemic is fake, this pandemic is this, things like that, right? Well, they don't see because I work in the COVID ICU too. They don't see what we have to deal with. And even to say alongside that, even if I was a floor nurse, speaking as a floor nurse as well, I don't see what the patients look like in the ICU, because when they come into the floors, yes, the med-surg floors, yes, they're sick, yes, they're coughing, but it does seem like the flu. However, fast forward, once you're in the ICU, they're on ventilators for weeks at a time. They're just so deconditioned. Normally, if you get someone with like pneumonia or something, you can get them out of the ventilator within like 3 or 4 days and they're like fine. But these people, they stay on the ventilator for weeks at a time. And I mean, SF General does I think we only have like a 10% mortality rate, if that, and that's like one of the best in the Bay Area. But if you look at other hospitals, they're up to like 60, 70, 80% mortalities in regards to their COVID ICU patients. Yeah.
And how was that for you, like personally and emotionally? Because I know we always talk about everything going on with this pandemic, how the patients are being affected, of course. But I think it's also important to reflect upon you guys, the nurses who are working at, like you said, 200 to 300% capacity, working overtime, all this. Like, how has that been for you, like, in an emotional standpoint?
It gets, I could just speak for ICUs in general. You do get sadly to say, you do get emotionally numb, just because you're just around death and grief all the time. Like, ICU is not a happy place. You have to be there because you want to be there. And speaking from my own personal life, I mean, I do a pretty good job in terms of, hey, this is me thinking about work, this is me thinking about my personal life. So, but so historically, I've always been really good at that. But I mean, with COVID and everything, I mean, everyone's just mentally down. No matter who you talk to in the ICU, no one's like, "Oh my God, I'm going to go to work today." It's like, just given the political climate, given economic, social, whatever. I mean, it affects everyone. So overall, I hope with everything that we just learned today, things do get a little bit better.
Yeah.
Props to you, man, because I feel like you, especially being in SF General, where there's like a huge population of homelessness, mental illness, and just like being in San Francisco in general, having that diverse population and seeing so much death, seeing so many injuries, seeing so much trauma. I think it's really good that, it seems like you've been able to kind of separate that part of your life, even though it's such a huge part, an important part of your life. You're able to kind of leave it at the hospital and kind of make sure that you have a life outside of nursing from that. Like, props to you, man.
And that goes with all floors too, because med-surg is just this.
Yeah, just having that separation from, your personal life and like the mentality going into the ICU is really important. That like, I feel like it like, just let me ask, it has helped you with your mental health and everything, like having that separation, like being able to, control both like the emotion, the emotional toll and like the physical toll. Like, did that all help with your mental health?
Oh, completely. I mean, there's some extremely, extremely good ICU nurses that I met that recently retired or recently quit because the traumas got too much. Like it's not only just being a good nurse, but it's also having that, again, emotional wall. So not a lot of people necessarily stay in trauma just because it's that subset, or even ICU for that matter. It's just that subset of people that can, still keep giving, even though the environment within themselves just taking everything away.
I feel like you guys probably ER too probably have the highest rate of burnout, because I think when you define burnout, it's kind of like, the work you put in is not stacking up to reward you're getting. It's more like it's taking it away. So I feel like you guys probably have like a huge burnout rate.
Oh shoot, I respect I respect our ER nurses so much. That's in general. Oh my gosh, yeah, it's definitely ER. It's I'd say highest risk for burnout. So much love to them.
Mm-hmm.
So just in regards to burnout, like how would you go about like dealing with your own burnout to make sure you're always fresh when you come into the unit?
Self-care techniques. So whatever that may be for anyone, whether that's, having that one night where you have to go just let loose, go to the bars, whatever, what have you. For me personally, I have to go to the gym. As chaotic of a work environment as I have, I try to keep my house all spotless. So it's kind of like my own OCD. It's my ritual. I have a clean house to come home to. My dogs are clean. Come home to my girlfriend. We go eat out. Go to night. Like even though we're paying for loans and whatnot, you have the money. Go have a nice dinner. Go do this. Spend time together. So it's whatever you can do to really bolster what you have outside of the hospital. I'd highly suggest. That's kind of what's helped me along the way.
Nice.
Yeah. And I don't know, I feel like that's something that we always advocate for. Like I always advocate that for too, but I feel like sometimes you give a lot of advice, and sometimes I can't even take my own advice sometimes, especially especially during this pandemic where I'm kind of talking on this podcast being like, here are the ways we can stop burning out, here are the ways we can do well in class and all that, but here I am struggling in this slump, not being able to do some of the therapeutic techniques and coping mechanisms as a result of this pandemic. It's like a weird thing where we always want to make sure that we're giving everyone advice and reassurance, but at the same time it's so hard to like take it in for yourself.
Oh yeah. Say it. Do as what is it? Say as I do as I say, not do as I do.
Yeah, something. Yeah, true.
Something like that.
Man, yeah, I don't know. Like, I don't know. Alan, how are you doing personally? I know we've kind of had our discussions about it, like outside the podcast, but how are you doing personally with all this going on?
For me, I think one of the major stressors recently was probably, the election. Like I think this morning, just a lot of that stress was relieved. after seeing like what was happening. But there's just so much uncertainty that uncertain thoughts that I had going into quarantine and like having to deal with COVID and having to go to nursing school during COVID-19.
Oh yeah.
Like for the first time, I think I caught myself having anxiety because I was just so like unsure of what was happening, and it's just, I caught myself. I was like, okay, just take a step back, look at all the positives, like do some self-care, and I really learned a lot from that because I've never had this feeling before. And just being able to identify that and really look at the things, look at the brighter side of things really, really helped. Mm-hmm. And finding ways to, better myself and like have a little bit more fun even in quarantine. Like I'm unable to see my friends. I can't go to school, see my fellow students. I can't talk to them about anything that I'm having in clinicals. You just have to find different mediums to fulfill those things. And I think I've done that. I'm still doing pretty well for myself. Like my mental's all in check, and it's just really, I'm having a fine time. I'm just waiting for this pandemic to be over so I can have a sense of normalcy again,
Mm-hmm.
What are you guys doing? I can't give it from a student standpoint anymore. So I'm curious what you guys are doing.
You want to answer first, Ryan?
Wait, what am I doing like to like cope and all that, like outside nursing and all that? Or like what am I doing in nursing school? What do you mean?
Like Alan touched on, hey, there's self-care things that I'm doing.
Yeah.
I'm seeing the brighter side of things. Like shit, I'm a pessimist at heart. I don't know. what is the brighter side? What are those things? I'm curious.
You go ahead, Ryan. Go ahead.
I was gonna say like for me personally, I feel like if I feel like I've turned into a pessimist as a result of COVID. But like usually when I think of like the brighter side, I kind of think of maybe me being able to focus more on my physical and mental health, in that I can like exercise more. I feel like sometimes when you go to USF, I was a commuter, so you have to drive, think about how all the scheduling stuff. I was working too. You don't really get a chance sometimes to work out because either my discipline wasn't that good or I was just stacked with all this other shit. But now that I kind of have the time, I don't need to drive to school. I can work out more consistently on a daily basis. And that's really helped me, not just physically, but mentally. And I think, what else? That's honestly it. I feel like I'm waiting for this shit to end. I want to go back to rock climbing, go back to spike ball, go back to basketball, ping pong. I need all that, bro.
Yeah, at least for me, like before, I'm a really active person. Like I like to, I swam a lot. I swam for varsity in high school. I picked up rock climbing a year or two ago, and just because of the pandemic, I can't do any of that. Even with weightlifting, I did weightlifting a ton. Can't go to the gym no more, right? And I was able to, get some weights and just work out at home, have a little bench, just do all like the body weight stuff. And going back to like all the brighter side of things, it's just like, despite me not being able to go out and see my friends and living a normal life, I still have my family. Like my family is super healthy. I get to see them a lot more than I usually do, even though, I'm from San Francisco. I go to USF because I really wanted to be part of the nursing program. I still live at home with my family, but even so, you know how busy nursing school is. I had work outside of nursing school. I had other obligations, like go work out, go swim for an hour or two. And it's just that the pandemic gave me an opportunity to really connect with my parents even further, and because my brother's always at home now too, my brother and I have 11-year gap. I'm just able to connect with my family a lot better, and I'm really, really appreciative of that. And throughout the pandemic, that was like my go-to. I'm just happy that my family's so close to me, and I'm happy that they're all super healthy, and that's what keeps driving me forward to like into the future.
Yeah. And kind of bringing it back to what Gabe said about when he graduated and all his friends kind of got dispersed. It's kind of like when you are apart from your friends for this amount of time, you kind of come to appreciate who your friends truly are. And it kind of does shine that light, like, oh, I actually, this person is very important to my life, and I want him or her to, continue being a part of it. I want to connect with them still, which is kind of why I was so so disappointed with the pandemic happening when it did, because I felt like I was starting to get to know so many new people, but because of the pandemic, it kind of like cut everything off where you can just
eliminated all that.
Eliminate, because before you can become like true, I guess, best friends or whatever, you kind of have to start with being friends by proximity. But sometimes if you don't kind of get that transition right, then it just kind of cuts everything off.
Yeah,
and then
you don't get that proximity no more.
Nah, bro. Yeah. So I feel like that's kind of a bummer. I feel like there was a lot of new connections I was forming that got cut off, and I like to think it's gonna reconnect in the future, but I have no idea.
Oh yeah, no one knows.
Yeah. Oh man, but yeah. I don't know. Maybe as a closing statement, you can kind of. I think we already touched on it because you already said like kind of your advice for new grads. But do you have any like further advice for people specifically in MSNS or just nursing students in general, about how to get through this pandemic? Not just get through it, but also to make the most out of it. Like
what they can learn and what they can take away from it.
Learn and take away from this pandemic. That's a hard question, guys.
Yeah. Just a little something,
Yeah, just a little closing statement.
If I was a student right now, and if I had to give myself advice in this pandemic, and given what you guys have been telling me and your own experiences being a student in this pandemic, my advice would be, in the hopes of a brighter day, of being able to see others and being able to go back to some normalcy of life, I'd say in this time of, yes, take care of yourselves. I'm glad you guys are able to work out more, spend more time with family, and trying to distract yourself away from the pandemic. Me personally, I would just be like, I would tell myself in that time to grind hard. Shit, you still have nursing school to go over. Not saying be anxious about it, but be excited about it. I don't know, it's a weird way to put it, but I don't know if you guys ever watched those Eric Thomas motivational speeches.
Oh yeah, yes.
Yeah, what is it? If you want to succeed as badly as you want to breathe, then you'll be successful. That shit was on repeat when I was a student constantly. Not because I didn't look at nursing school in a way where it's like, oh shit, like I have all these classes. I tried not to anyway. That dawned on me every single freaking day. Yeah. Junior 1, I was like, man, I gotta handle all these lectures. Junior 2, oh shit, I gotta handle all these lectures these skills. I just wait for it. But I always saw, as much as a pessimist as I am, I always saw the light at the end of the tunnel, because I talked to all the alumni, because they were like, yeah, dude, like we're doing this, we're going on these vacations. Oh yeah, dude, I just coded this patient and I went to like Tahiti the next day. Shit like that. Not I don't want to put it into like a materialistic view of nursing and those rewards, but what you guys are doing now, again, is the hardest part of nursing, is the schooling, because you guys have to just get over that learning curve. But be motivated, because you guys are almost there. So, freshman 1s, whoever I'm talking to out there, you guys are just starting. You'll get it.
That's true.
Sophomores, you're in the midst of it. Juniors and seniors, you guys are doing it. It's only a year. Just think about it. It's only a year's time, a semester's time. You still have summer. You know what I mean? College went by so fast for me, just because, I was so busy. In between that, I was trying to have fun as well. But within this short span of time, there is so much of a future you guys to look forward to. You guys are going to, again, be 21, 22, with a career in line, with retire. I don't know. I always looked at retirement. With retirement, being set up, your parents don't ever have to come to you and be like, hey, what are you doing with your life? It's like, what are you talking about? I'm good.
Yeah.
You guys are going to be the ones where people look up to you, where it's like, hey, I want you to be as successful as my son. I want you to be successful as my daughter. She's a nurse over here. She already bought a house in the Bay Area. I was like, I don't even know how that happens at this age. And I mean, my girlfriend, she's delivering babies. Me, I'm trying to save people. I see you. So there's so much reward in store for you guys that's in between those lines and those textbooks and whatnot. So grind hard, but take care of yourself when you can. It's almost nursing school is almost over for you guys. For people starting, it goes by real quick. And I mean, I'm hoping this pandemic ends pretty quickly too.
Yeah.
Now that things are a little different.
Just a little bit,
For
just
sure.
a little bit.
A little different.
Little tiny difference. Yeah.
But yeah, thank you so much, Gabe, for being on the podcast. Like,
yeah,
and also a big welcome to Alan once again. For being the co-host from now on. Welcome. Yeah.
Thank you, Gabe, so much for your insight. I think everything that you said just really helps me, and it can. I hope it can help the listeners too. We do appreciate you taking your time and talking to us and talking about your ICU experience and criticizing your what is it, your coworkers for buying turtle doves for $1,000, man. Oh man, I can't get over that.
They can buy resale. That's what I'm saying.
Yeah, that's what I'm saying, bro. Oh my
god, Jesus,
can't deal with that.
Oh my god. But yes, and also I also like to give a special shout out to whoever actually listened to the entire podcast. Shout out to them.
Shout out to you guys.
Those are the real heroes. Shout out to them. I know there are a couple out there.
Yeah, finish listening to it. Drop us a comment. Yeah.
Yes. All right, and yeah. So, make sure you guys like the video, subscribe, and all that.
Don't forget to share.
Yes. And we will see you guys next time. Thank you.
Peace. Thank you, guys.